Hey, today we're at Omni Family Health at their Stein location, and July is Make Prevention a Priority Month. So today we're going to find out some tips on how to reduce your risk of heart attack and stroke. I'm joined now by Dr. Grace Tidwell. We're talking about heart health and more specifically prevention of heart attack and stroke. So Dr. Tidwell, who's most at risk for heart attack and stroke?
Yeah, well, thanks for having me. Absolutely. So certain folks are at a lot higher risk of stroke and heart attack. And some of those things we can't change. So if you're older, if you have a family history, but then there are some factors that we are able to modify. So things like having uncontrolled diabetes, having uncontrolled high blood pressure, having some extra weight on us, having high cholesterol, smoking. Those are all things that we're able to modify that do contribute to our risk.
Okay, so with that all being said, what are the best ways to lower the risk of heart attack and stroke?
So if you're someone that has one of those medical conditions, getting it under control is the best way. So if you have diabetes, if you have high blood pressure, getting that under control. If you smoke or you drink a lot of alcohol, cutting back or quitting those. If you are someone who doesn't have those, doing things like keeping to a healthy diet that's full of vegetables, fruits, real foods, less processed foods, that helps. Having a plan of regular exercise is really helpful, and then maintaining a healthy weight.
It always goes back to a healthy lifestyle, diet, and exercise, but there are cases where people might need some medicine. Tell me about that.
There are two main classes of medications that we use for prevention. The first one is called statins, and those are medications for lowering cholesterol. All of their names end in statin, so atorvastatin, simvastatin, medications like those fall into that category. And then there's also low-dose aspirin. It's sometimes also called baby aspirin, but don't give it to babies. And it basically helps your blood be less sticky. It affects how a certain blood cell called a platelet works. Platelets help your blood clot, and so this makes them not be as sticky, not clot as well, and also not form a clot in your arteries where you don't want them, so bringing down that risk of stroke or heart attack. Of course, making it less sticky means you are a bit more likely to bleed. So I always encourage folks, if they're gonna start aspirin, be sure to discuss it with your medical provider first to make sure it's right for you.
So how do the medicines for cholesterol work exactly?
So medicines for cholesterol decrease the level of bad cholesterol, which is low density lipoprotein, or LDL, in our blood. And so that's this waxy, kind of fatty substance that when it's in too high amounts, especially combined with those other risk factors, can lead to blood clots. It can block those arteries and block off the blood supply, leading to strokes and heart attacks. So medications called statins, and you might have heard of some of the names of them, like atorvastatin, simvastatin, anything that ends in statin, bring that level down and reduce your risk of a stroke or heart attack.
Dr. Tidwell, thank you so much for all of these tips on prevention for heart attack and stroke. It's so important. And for anyone else that has questions, you can go to Omni Family Health. You can visit their website or give them a phone call.